as well. All right. Okay, so we're live. Hi, everyone. Hi, I'm Dr. Benny Salavoide, and it's my pleasure to welcome you all to ATP Live Monday. Thank you so much for those who are joining me. So I'm just going to quickly put up everything on our Facebook group, whether you're watching on Instagram or YouTube. You're welcome, and feel free to drop your questions as comments in whichever platform you have. I'm just quickly going to set up for those on Facebook. Just bear with me a minute, and I'm waiting for Angela to join me. All right, where's the wash party? Okay. Hi, Nikki B. I Frankis. Yeah, sound different. Okay, I think I can see Angela. All right. Hi, Angela.
Hi, Dr. Benny.
How are you doing?
I'm fine, thank you. Good evening from Nigeria.
Good evening from all over the world.
Yes.
Okay. So,
Hi, everyone. Hello to the 10 people who have joined us already. Thank you for keeping to time and being on time. Yeah.
okay.
Yeah.
So I'm just setting up the watch party on the Facebook group. So just 1 minute, but you can keep welcoming those who are joining us.
Okay. So, as you know, it's ATP Live today. We do it every Monday, and we also stream it live on a YouTube channel and on Facebook. It's a day when you're free to ask your questions directly to our doctor, and then she'll give you an answer immediately on the spot. What are the thanks for joining us. Francis, thank you and good evening. Thank you for following all our posts on Facebook. God bless you too. We don't take it for granted, and we hope that you learn a thing or two for your children too. Musueda, I know you. Thank you for joining us all the way from Kenya.
Wow, that's amazing. Wow. Trying to adjust
Royalty Delight is here. Thank you, Royalty. Thank you for joining us. Shoe Merchant, you're welcome to another session of ATP Live. Let's say Obaido, you're welcome again to ATP Live.
I hope my head is not cutting off. Trying
Hi,
to.
Edwin, I see you too.
Okay, I think we can start. I think I've posted in all the groups. Okay, all right. I think we can start.
Yes, we can.
Yeah. Just 1 minute. Let me just pin it in the ATP family because I always tend to forget them. But you can go ahead.
Bias Connect, you're welcome. Tekina Ojewumi, you're welcome. And thank you for joining us. Oluwayemi Yoshio, thank you too for joining us. I'm sorry if I'm mispronouncing your names. Chi Oche has just joined. Thank you. If you have any child health related questions, um, please just go ahead and send it in. I'm going to read it out for the doctor and she will give you an answer
Okay.
to advise you what you do to any child health related question. Please drop it in the comment box and we're just waiting for you. We're here.
Okay, I think we can start now, I guess, and I can see all the people on Facebook joining us as well. Good evening, everyone. Good evening. Post all your faces. So please, if you have any question, drop it wherever you're watching on Facebook, on Instagram, or on YouTube. I will try and address them. So we'll start with Instagram, and then we'll go in between Facebook, and I hope those on Facebook can hear. Um, uh, Let me just make the volume louder. I hope they can hear Angela loud and clear. So somebody should just let me know whether you can hear her. So because they are going to, yeah, because they're only seeing me on Facebook. I'm not sure whether if I turn my camera to you, whether they will see my video. Oh, it will be too small. Okay, no worry. Okay, fine. Let's just continue. Okay, can we start? Oh no, what happens
Yes,
to
we
my
can. We just
lights?
have one question for now.
Okay, let's go on.
It's from Vice Connect. It's saying, thank you for all you do. You've made us better moms. Please, does Infacol work for reflux?
Yeah, Infacol is meant for colic. Sorry, I think my light went off. Infacol is actually meant for colic and not reflux per se. So most reflux in children are they resolve on their own. Most of them are mild and there's no reason to worry. But if the reflux is very bad, then you may need to see a pediatrician. So what do I mean by a very bad reflux? So bad reflux would be a child who is practically bringing back everything you put in their mouth. That is one. Two, in addition to that, they are losing weight. They are not able to retain the weight. They are not able to gain weight. They are not thriving. So children who have those kind of situation, those are the ones that we will really classify as having severe form of reflux, and we have our way of dealing with severe reflux. And one of the things we do is to thicken the milk. We have what we call milk thickness, and so there are other medication that we also use as well, like the what people call the like some of the drugs we give you for antacids and all that we use for treating ulcers. Some of them can be used as well. So those are the medication that we use. So you really need to see a pediatrician for that. Please um, don't self-medicate when it comes to that, especially when you're talking about babies. Don't self-medicate. See a pediatrician, and we will give you the right direction. Okay. So I hope I've addressed that. Okay, something is wrong with my
Bias Connect, I
lights.
hope that was helpful.
Yeah.
We have one other one from Frankie says, and she said, I dewormed my 16-month-old boy a few days ago, and his appetite has been poor ever since. I've been asked to resume giving him Adhd multivitamins daily. I think the question here is there any relationship between deworming and loss of appetite? I think that's what she wants to
No,
know.
I don't think so. There's really absolutely no link between deworming and appetite. So sometimes parents tend to make a lot of connections that are not necessarily that have no link whatsoever. The fact that you deworm a child who is going to be sick, for example, and you maybe incidentally deworm that child, does not mean that child will now, it is because of what you did that is causing that. So that could just be a coincidence. So there's really no reason for you to worry about it. So if the child is not eating, how old is this child? You didn't tell us the age.
16 months.
Yeah, 16 months old. If it's just something, just watch for now. I'm not so sure how long that has been going on. If it's just like for a few days, you just watch and see how it will resolve. But if it persists, please don't assume it's because you're the worm. you may want to actually take that child to see a pediatrician for further evaluation. Personally, I don't think giving multivitamins and all that do anything to appetite. That is our assumptions. Most of us make that assumption a lot of the time, but really, there is really no link to it. So, appetite, loss of appetite may be due to so many things. So, it's difficult to say which one it is in your own case without asking further questions. So, if the child doesn't have fever, doesn't have any other thing else, just watch and then try and offer more food. But if it persists, then you may want to take it up with seeing your pediatrician for further evaluation. I hope that is helpful.
Okay, she sent in a follow-up question and said, so he doesn't eat a variety of food.
So this
only
is
eats golden morn and custard. He vomits or spits everything I give to him.
number one, your 16-month-old should not be eating golden morn. And so this is not a deworming issue. So this is there's an underlying issue here that's been going on. And so that is what you really need to sort out first, and not to just assume it has to do with the warming. So this child is already having issue with feeding, and I could imagine that if your baby is not eating well and is only eating some cereals all the time, then obviously the child, after a while, the child also start getting tired of that same food and all that. So this is a child that we need to address the issue of feeding, complementary feeding. And like virtually every time we come to Facebook or we go live, we have to address that complementary feeding issue, because that seems to be the most frequently asked question. And I think, like I always try to say, is that sometimes, because if the foundation is wrong, like we've mixed it up right from the beginning, then we're going to have issues. And so that is what is happening. My light is not coming on. So that is what is happening in this situation. And what we need to do is to, for go back. I always like to refer people back to watch our videos. We have Global Health Videos has produced a lot of very lovely videos on complementary feeding that you may find very useful. You may also want to use that, go through it, go back, make sure you're doing number one, what should you feed a child? What quantities should the child be eating? You should still be breastfeeding, I hope. If you are not, you should. All those kind of things. You go back to them, try how to mix, different food for the child and all that. So those are the kind of things that we should be doing first. And if all that is not up for you, may want to see a pediatrician or a dietitian or nutritionist. If you go back to after this program, even on this platform, I've brought in a pediatric nutritionist, and she has run through all this, how to work with feeding issue for the children. So you may want to watch that episode. Just watch for ATP Live special with the pediatric nutritionist and listen to it. Listen to all the tips and all that. There's no quick fix. Most parents are looking for us to give you a particular drug or tablet that you just go and use, and then your child becomes begin to eat ferociously. There's nothing like that. I always tell people there's nothing. So you just need to walk through some of these simple strategies, yeah, and then begin to implement them. That's what you should do. And most of the time, we also try to contributed to this problem by just offering this quick fix kind of food. No, it's not the best. We need to go to the kitchen, we need to cook properly for the children, and then you need to make sure you're mixing the right kind of food classes. We have what we call food classes. So the children must be eating from all those food classes, including fruits, including vegetables. They are all parts of what the children should be eating. So it's not just cereal, and then we think we're doing complementary food. So, like I said, this is something we've talked over and over again. You can't watch any of the ATP Live videos without getting the answer to this. But most importantly, I think I found the videos very, very useful in the sense that you can watch them. And I'm beginning to discover a trend that those who watch the videos before they get to the point when they start complementary feeding, they do it better because they know they have the information. So they go in right at the beginning, and it's helpful. But trying to fix it, but it doesn't mean that it cannot still be fixed. It can. So I will just leave it at that.
All right. So you have your response there. But first of all, your 16-month-old should not be eating golden one.
Yeah, the
That's
manufacturer have said they want it to be from 3 years. There are other cereals that are age appropriate for that child. So by the same manufacturer anyway. So why not go for the ones that are made for that particular age group? Yeah.
That's true. Yeah. Okay, moving on. Dr. Dayo is saying, please, my daughter is 1 year old. She has constipation for months. I've tried all things, but since it's not working, I tried to book an appointment to see the doctor, but not possible due to lockdown.
So constipation, when you say you've tried everything, first I want to know what you have tried, because I'm always somebody that needs to know. Okay, because usually even when it comes to constipation, most of us pediatricians, we're still going to go back to first principles. Basically, water, is the child taking a lot of water, a child drinking a lot. Two, and but you, because you said it's for months, and I'm like, this child is just 1 year old. So when did this thing start? Is it when you started complementary feeding and all that? So a child who is on complementary feeding must drink water. Like that 1 year old should be drinking at least 1 liter of water every day. And so the child must take fruits and must take vegetables. Some of these things, most of us, just like from the last question we're answering, most parents just think complementary feeding is just cereal and milk. No, that is always the problem. Most of these cereals, some are really the ones that have been over processed and packaged for us into the boxes. They don't have a lot of fiber in them. So you need to make sure that we give children food that are rich in fiber. I know that most children don't like eating vegetables straight away when they say it, but there's a way you can hide it. So for example, when you're making your cereal, you can puree the fruit into the cereal itself. There are many ways you can mix it up so that the children will eat those vegetables without necessarily seeing the greens or getting scared of them. So we must make sure that our children are eating fruits and vegetables. They are drinking lots of water. So if the children are eating properly and they are still breastfeeding as well, 1 year old should still be breastfeeding, and the child is having constipation, then we may want to look for that, like, is there something else going on? So some children have some other medical issues that may cause constipation. Then we can look into that. We can give some drugs to soften the stool softener and all that. But the best thing is to work from the primary principles: fluids, fruits, vegetable, food rich in high in fiber, those kind of food. Those are things we want. So if those ones have not helped, then that is where any doctor, even, can prescribe stool softener. The children can use like lactulose, like Movicol. There are lots of them. And then, but even when you use those things, it's not like they are magical. They will help initially to let the hard one come out, but you now need to maintain the lifestyle of making sure the child is not eating. And all these things we give children, like biscuits, pastries, and all that, they're also not good in fiber, and they can also contribute to all these things. So we must make sure that children drink water. It's very, very important. So that will be helpful. So if you've tried some of the things I've mentioned, then definitely you really need to see the doctors, and then they can give you other, we can ask more questions, and then we can provide some other supports.
Yeah, she went on to say now she screams when she wants to poop, and she's also changed to a picky eater. Is constipation the cause? She only wants breast milk and fruit puree.
No, I don't think the constipation is the cause. But if the child is really constipated, the child obviously may have a full tummy and may just not be interested. It's a very uncomfortable thing. When children have constipation, they have abdominal pain. It's not comfortable for them. That's why she's also screaming and all that, because it becomes a vicious circle. Because when the child wants to now pass the stool, because the stool is hard, if it is you as an adult, sometimes you just bear it and let it out. But most times children will not want to bear it, so they invariably kind of withhold the stool from coming out because of the fear of that pain. That's the issue. So usually some of those children may need enemas, they may need suppositories to for make it easier for them to pass the initial wall, so that the thing just doesn't keep accumulating and accumulating, because now the child is in that phase where when the stool wants to come out, so the child is deliberately keeping it down from coming out because of the pain. So that is why it's too soft now. You can try something like liquid paraffin at home. These are some of, if you go to your local pharmacy can still prescribe some of those too soft now for you. You don't really need to see a doctor for that. They are over the counter medications. Just to forget out the initial one, then after that you can now start working. But if the child keep getting constipated again, then definitely the child will need further evaluation and investigations to know why. Yeah.
Right. All right. Motube Folarin is saying, I'm breastfeeding exclusively, but my baby has a viral infection and was given ORS. Does this mean breastfeeding is no longer exclusive?
How old is this child?
She didn't say, but less than 6 months, it's still
Okay.
exclusively breastfeeding.
Okay, so number one, I always like to know the age of the child, and I also want to know what you mean by diarrhea, because I found out that most parents mistaken the normal soft stool, which is semi-solid stools that we get in breastfed babies. They always think it's diarrhea. It is not diarrhea. Breastfed babies don't pass solid hard stools. They usually pass stools that look like some solid parts and some liquid part, and that is not diarrhea at all. And that child does not require any ORS or anything. That child is fine. So usually when parents tell me the baby breastfed baby is having diarrhea, I always want to ask them, how is the stool completely liquid like urine, completely sinking into the diaper? Because that is when I will count it as diarrhea. If you can still see some solid part, what Yoruba people call egusi soup kind of picture, where you see some solid yellowish part and some liquid part, that is not diarrhea. That is normal stool for a baby on breast milk. So we really need to be sure because babies on breast milk really don't have diarrhea. They don't, because the breast milk won't allow that. But there are many reasons why they can have diarrhea. Some of you will say you are doing exclusive breastfeeding, but you're also giving water. I mean, I've seen so many questions that sometimes I actually wonder, really, because people keeps asking me, "Oh, do you mean babies on exclusive breast should not be given water?" Or they, I mean, so that means some people don't even understand that giving water means baby is no longer exclusive breastfed. Some of us are also giving drugs. Some of those drugs also can have side effects of diarrhea and all that. So it could be reason why baby could have diarrhea. Or some of us, we are also taking drugs ourselves. If you're as a mother, you are taking some drugs, or you are eating some particular kind of food flavors and all that. Some of them, everything you eat most of them can go into your breast milk and can affect the baby's bowel movements, and that may be the reason why baby is having diarrhea. And of course, your hygiene is also important. Wash your hands before feeding the baby, clean your breast and all that. So if you are doing all that, your baby really should not have diarrhea. Your baby is having diarrhea, we need to look why, and then we can address the reason. But if your baby is just having the semi-solid stools, then that's not diarrhea, and that is just normal stools, and baby doesn't need uh, ORS. But if your baby really is having frank diarrhea, like liquid going into the diaper, yes, of course. Usually we give ORS to babies above 3 months, because even below 3 months, you should not give them ORS anything, because what you still need to give them is just the breast milk. The breast milk will still rehydrate the baby. The essence of the ORS is to rehydrate the baby. And if you give enough breast milk, your baby will be rehydrated. The breast milk contains everything that the baby needs. So just breastfeed more. But if it is really very watery stools in like children above 3 years old, 3 months old, then we can give ORS. So yes, at that point when you're giving the ORS, this is treatment. So when you are giving something as treatment for a baby on exclusive breastfeeding, we won't really say you are no longer exclusive breastfeeding, because you are giving a treatment for a particular illness. Like it's just like a drug. So but as soon as your baby diarrhea stop, of course you stop and continue your breast milk only. So I won't really say you are no longer exclusive breastfeeding. I'll just say your baby is on treatment for that period, because it's not as if you are now giving water like for other people. That it's not as if the baby is sick and we are treating the child, but they're just giving it continuously. That one is not exclusive breastfeeding. But if you just give your baby drug or ORS for a short period for treatment of a particular illness, we will not classify you as not still doing exclusive breastfeeding. Okay, but I just hope you are really clear in terms of the when you really should give, because some of our doctors are not pediatricians, and some of them sometimes don't know the difference between the way they would treat a child and the way they would treat an adult. So sometimes I find that they lump them together. So usually, but if this pediatrician, we try to ask more questions to really be sure what we're treating, so that we don't just think, oh, every stool that is not solid, because that's what most mothers think, because the stool is not solid, then it is diarrhea. It is not necessarily diarrhea.
All
Okay,
right.
should I go on to Facebook so that we don't end up leaving Facebook behind? Because let me just take a few questions on Facebook.
It's just a follow-up question to what you already just explained. That's Margaret Benson asking, what if there's mucus in the poo?
For which kind of baby? Baby on breast milk, baby, ordinary baby? Because it matters. Okay, so there are many reasons why baby could have mucus, because the lining of the intestine, there are some things that cover it, and when they are shed into the stool, that's what you actually see in the stool as what look like mucus and all that. So the context really matters. If it's a very healthy child, otherwise, well, nothing else. I would just say watch what you are eating, watch what you are giving the baby. If it's a baby on exclusive breastfeeding, but the stool is not watery, you see what look like little mucus in the stool, there's no reason to worry. But if your baby is passing like only mucus as stool, or even mixed with blood, or mixed with very watery stool, then we want to worry that, oh, there an infection going on. Because if there's an infection like a gastroenteritis, the lining of those intestine is infected and they are shed a lot into the stool, and that's what comes across as the mucoid stool that most of us see. And then we need to know why. Is baby having any infection? Do we need to treat it? Actually, when you see blood is actually what we worry most about, and that's definitely a treatment case for a pediatrician to deal with. Okay,
All right.
thank
Thank
you.
you.
Yeah. Okay, so let's just
The
keep.
lovely reporter. Okay.
No worry, we'll come
Just
back. We will come back. Just
all
we'll
right.
come
All
back.
right.
Okay, so from Facebook, Benga is asking Olasode, why will a 8-year-old not want to eat? I mean, that's a very broad question. I mean, I don't know. Is the baby eating before and now stop eating, or what? So I can't just say why will an 8-year-old not want to eat. There's no reason why an 8-year-old won't want to eat, unless there's something wrong somewhere, and it has to be particularly specific to that child. So when you're asking questions, you have to ask more specific questions, like a little bit more detail into that particular case, rather than if you just make it so open-ended. I mean, my own answer can also be as open-ended. So there, some people are just picky eaters as well. Some people don't like to eat much, and some parents always think that the children need to eat so much. And I don't know why that is the case, because when the children are small, we want them to eat so much. And when they are whole teenagers, we want them to eat so little. So then it becomes a vicious cycle. The most important thing is to maintain the healthy balance. So if this child has been eating well, Mr. Benga, and the child is otherwise has normal weight and everything, and then the child suddenly stop eating, it may be what we call poor appetite. And poor appetite is a symptom you find in virtually any illness, malaria, infection. Most illness will present with poor appetite first. That may even be the first symptom that you will say. Or it may just be a child, constipation too may make a child not to want to eat and all that, because their tummy is so full and all that. So there are many reasons. Or it may just be a child who is just a picky eater. Or it may even be a sign of a child who is going through some traumatic experience at school, for example. So the list is endless. So you have to be more specific with your own particular case for us to be able to say why the child is not eating. Okay, Oluchukwu Jesus say, my children have cough since 3 months old, and I've been taking treatment from the doctor. Please, whenever you're asking question, please tell me the age of your children. It's very, very important. If you don't tell me the age, so pediatricians will see children from zero second of life, or zero from one second of life. In fact, we actually see children from their womb to 18 years. So the kind of answer you will give to a question about a 3-month-old baby is not the same answer you give to a 18-year-old or a 17-year-old. So the age of a child is the most important information for a pediatrician. So whenever you're asking questions, Many people ask this question without really thinking much about it, but the pediatrician is first of all looking for the age. How old is this child? So that I know where to which category to put the child first. So for Oluchukwu, you have to ask your question again because your children are having cough, but you've not told me how old they are now, but you said they've been having cough since they are 3 months old. So if a child is having cough or catarrh for more than 2 weeks, we call it chronic. It has become chronic. If it is coming on and off, we call it recurrent. So there are causes of recurrent cough, there are causes of recurrent catarrh. Some of them may have what we call allergic conditions. Allergic conditions are the condition that tend to happen again because something is triggering them or something is when a child is exposed to something, they tend to have that symptom over and over again. So that's the number one thing I would think about in a child who is having recurrent cough, recurrent catarrh. So am I thinking, is it allergic rhinitis? That's the catarrh. Or is he a bronchial asthma? That's the cough. Or does the child have a medical condition that we have not yet diagnosed and we have not yet treated? For example, a child who has a heart condition may have cough over and over again. So we need to know why. So such children need to be, if a child is having cough over and over again or catarrh over and over again, you really need to take the child to see a pediatrician who will ask a lot of questions, who will examine the child, and after that we'll be able to tell you, okay, this is what we think is the cause of this or not. So you may want to provide more information. Ada is saying, my child of year 5 months old is constipated. She cries while trying to poo. So Ada, I hope you were around when I was answering the question on constipation. If you were not, I think you were around, so you must have had my answer. Give lots of water, give lots of fruits, vegetables, food that are rich in fiber. If all those didn't work, you can still get something like stool softener from your local pharmacy, but you must see your pediatrician to know why the child is having uh, constipation here. And one of the reasons why also children get constipated is that they tend to be told there's stool. Some children don't like the toilet they use at school. For example, this is this 1 year old, 1 year 5 months old, I believe they are home, so they are still with you. Two is that if they are doing something, they don't want to leave what they're doing, so they will told the stool, then they will told this, they will. So one of the methods is to let children have a regular bowel movement, and the easiest way for these younger ones is to put them on the potty at specific time of the day. So for example, first thing in the morning, let them sit on the potty. They don't even have to do anything. Let them just go and sit on it. So when they learn to do that, it helps them to easily pull all the time. So they kind of get it into a routine. So, or maybe last thing at night, put them on the potty. If you begin to put them on that potty every day, if you kind of introduce the habit, so they tend to move their bowel first thing in the morning, it really helps them a lot. Then when they wake up in the morning, they can drink water as well. So these are some of the ways you do it so that the children don't get into the habit of withholding their stool, because it's very easy for them to do it because they are playing. They don't want to leave that play. They want to keep on playing. So when they have the urge, they will just not go. Then when they have the urge, they will not go. So, but another thing is that we also must make sure that the stool is not hard by making sure they drink lots of water. And we have to model this for the children. We have to let them see drinking water as a normal thing. It's not only when they eat that they should drink water. They should drink water throughout the whole day. So give them sips of water. Please, let's not be giving them all these juices and all that, except it's the fresh fruits, like you make your own smoothies and or juice from your own kitchen. That is fine, but otherwise we should let them drink water. And this habit, some of us mothers from day one, we start introducing. When I go to church, sometimes I see mothers giving their babies all this colored water in the bottles. I just shake my head. So that is wrong. A child, you are just, these are even infants. They are still babies on that should not even be drinking anything because they are on breast milk. When we want to introduce water to children, introduce water, plain water. Don't color it with anything. Don't make it tasty. Just plain water with you. I always tell mothers, your children don't know anything. It is what you give to them that they know. They don't know there's anything that tastes this way until you give it to them, and then they prefer it and they want it. So they always want that thing instead of the water. But if you don't offer those other things, sugary juices to them, they will know that the only thing available is water, and they will be drinking water. There are many ways you can make them drink water. Buy them all these nice sippy cups with cartoon character, straw, turn it into a game, turn it into a play. Let them just play with it. It doesn't matter. So that way they get used to water, because that's another thing people complain. My children don't want to drink water because we don't give them water. From 6 months, we should be giving them water, and they can take a little sip throughout the whole day. They don't have to drink it as a gulp, maybe after food, so that their tummy will not start shaking with a lot of water inside. So we let them drink it, throughout the whole day. I hope that is very helpful for preventing constipation. Okay, so Aisha Adam is asking, is it good to give 7 weeks baby gripe water? No. Can I give the baby cod liver oil? No. My baby high is always removing water like tears and Apollo. Apollo, I guess, means red eyes. What can I give the baby? So if your baby has red eye and discharge, that baby need to see a pediatrician or any doctor, because that child has eye infection. We call it conjunctivitis and all that. The child will need antibiotic eye drop, and that's what you need to give. Yeah, okay, so you have given what can I give? Because I told you maybe to the eye clinic, good, but it didn't work. So if you go to an eye clinic and they give your child a particular thing to use and it didn't work, you have to go back. You see, now the reason why you should go back is that if you go to another doctor who does not know that you've gone to an eye clinic before, that doctor will also give you the same thing, and then we'll keep on wasting time. But if you have gone back to the first doctor, that doctor know that I've tried it. It is not the doctor's fault. So parents need to understand one thing. When you go for treatment and we give you treatment and it appears it doesn't work, it doesn't mean the doctor does not know work. It doesn't mean that the doctor is not a good doctor or anything. No, there are many reasons why the initial treatment may not work. For example, there are some drugs we normally use, what we call first line drug. That's the first thing anybody will give you, because that is how we're taught, in that when you see this kind of thing, this is the first thing you use. But we know that in some cases it may not work for that particular child or that particular bacteria or whatever is causing that infection, which means we need to use something else. So, but if you don't go back to the doctor will assume the first one has worked. But if you go back to them and then they will now, oh, this didn't work, let's try something else. Sometimes we try something, it didn't work as well, because there are what we call resistance. So some of these germs, they are very resistant to the common drug. That is why we should not abuse antibiotics. So what the doctors will do, sometimes we will do what we call a culture. We will take part of that discharge, we will send it to the lab. Then the lab will test it. They will know the germ that is causing it, and then they will tell us this is the best antibiotic to use. If you use this one, it's not going to work. That's what we call sensitivity. They do that kind of a test for us. So the doctor will now know, okay, this is why this one is not working, because this particular germ is not sensitive to this particular antibiotic, but this is a particular antibiotic the germ is sensitive to. So that is when they will now use the correct one. So that is how it works. So please don't always get upset if you go to hospital and what treatment the doctor gives you doesn't work. It doesn't mean that doctor is not a good doctor or the doctor is not competent. There are many reasons. Maybe I will come one day to really take that as a whole topic to explain, because most time I tell people go back to the hospital. People wonder, why do I say go back to that same hospital? There are many reasons why you have to go back, because that same doctor already knows what he or she is thinking and what they've tried. Then they know that, oh, then if this didn't work, then it may be we have to try the next line of treatment, or we have to think about our diagnosis. Maybe we need to look, because sometimes, I always tell people that we are not oracles, we are not diviners. It is what you tell us, and it is what we see that will help us to know what is wrong. That is how diagnoses are made anywhere in the world. Sometimes we do tests to help us as well. So sometimes there are 2 or 3 things that can present the same way, that can look the same way. So, but we'll look at, okay, this is most likely, and we'll treat that one. So if what we treated didn't work, then we may think, oh, maybe it is not the number one differential, the number one most likely. Maybe it's something the second one. And that is why going back for follow-up is so important, that when your doctor is treating you, whether your child gets better or not, you should go back to them so that they will check again to make sure that, okay, yes, we are on the course, we are on the right course, or no, we need to try something else. So it doesn't mean the doctor doesn't know work. It is just how medicine is practiced all over the world. I hope that's helpful. So, Mr. Adam, based on other questions, newborn babies don't need any medication. Please stop giving them all these unnecessary drugs, gripe water, Bomoro, Bodan Babe, all those things. Very unnecessary. I don't know. I think we've been clamoring for the what do they call them now? The people that approve NAFDAC and the rest of them. Some of those drugs need to be banned, honestly. But you see, there are a lot of factors responsible, because it is about economy and people making money and all that. And to be honest, NAFDAC is about safety. NAFDAC, so because a lot of mothers were fighting a lot on the post I made about teaching drugs, and somebody asked a valid question, that if these drugs are not necessary, why are they available? Why are people making them? Now, let me answer that question by saying that most of those drugs, people make them, the people that regulate drugs, what they regulate is, can this drug cause harm or not? They are not regulating whether it is working for what they said it's going to work for. No, that's not their job. So that is number one. Now, most of those syndrome, what do they have? They will have a little bit of paracetamol. They will have a little bit of Phenergan, something to make the child sleep and all that. And they will mix it together. Or like some of those, like, I don't know whether it's Bonabib, one of those ones. They will have maybe chloroquine, a little bit of paracetamol, a little bit of Phenergan, and then they will sell it to you as sitting drugs. Now, paracetamol on its own is a normal drug that doctors use. Chloroquine on its own is a normal drug. Phenergan on its own is a drug that we can use. Now, the question is, if you are giving them when they are not needed, and some of you will give them from the day your baby is born to whichever, maybe 1 year. Paracetamol on its own is a drug that anybody can use, but you know it can damage the liver. It can cause liver failure if you take too much of it. There is no drug that is not a poison. It is the quantity of that drug that you put into your body that will determine whether that drug is going to be a poison or not. So if you take too much paracetamol, it will damage your liver and you will need a liver transplant. That is the honest truth. So when people give teething drug, teething doesn't require any drug, but you are giving paracetamol, giving Phenergan, giving all those things continuously. Some of you will give it 3 times a day for 1 year. Then you will now say, oh, later my baby is having this, is having that. That is what is causing that state. No, when the my Pekin saga happened, a lot of children died from renal failure because their parents were giving them my Pekin, which is supposed to be a teaching drug, which the children don't even need in the first place, which has been contaminated with methanol. I was part of those people that were managing those children. Those, you can go and Google it; it's all over the internet. So a lot of our children die from renal failure. Why? Because they are giving a drug that they don't even need in the first place for no reason. So the fact that drugs are being sold does not mean you need to use them. That is the truth I'm telling you. So you need to understand that. And I personally don't have any issue with you as an adult using any drug for yourself. You are an adult, you can take your own decision. But I worry about the children that don't know anything. And you are giving them the drug. That's why I come for you, because I don't want to give in the children what they don't need and creating unnecessary problem. And sometimes what the children need, you don't go for that. A child who is sick, a child who is having fever, the child may be having pneumonia, the child may be having meningitis. You will think, oh, it is teething. You are giving paracetamol and Phenergan, which is what is in your teething drug, and you don't go to the hospital. And then the child will die because you didn't go to hospital because you assume that that fever or that diarrhea is because of teething. So number one, you have denied the child seeking the right help. Teething does not make your child to have high fever, does not make them to have diarrhea, does not make them to have. Your child is sick. Don't assume teething. Take the children to the hospital. Don't give them, and if your child is not sick, stop giving them unnecessary drugs. Stop damaging their organs, because these things are very important. I know I've gone overboard on this, but this is something that I'm very passionate about, because we are the ones seeing these children all the time and we know what happens. And but when we talk to mothers, sometimes mothers like to argue them a lot because you are not the one that have gone through it. Parents who have gone through bad experience have lost their children, they are not going to come on social media and be talking about it because they are in pain. But you have not gone through that bad experience. We don't want you to go through it. That's why we that have seen it are telling you, but it's for your own good, whether you take it or not. So I hope we have clarified the issue of drug because it's one of the most frequently asked question. Okay, I think let me just answer one more question and we'll come back to um, Instagram.
Instagram. All right.
Okay, DPI is asking, my 5 month old is always pooing and his poop is greenish. So your baby, is it on breast milk or formula? So maybe some breast milk. If you're having greenish stool, it may likely be that you're not giving them enough breast milk. So you need to make sure you are breastfeeding more frequently. But babies on formula, some of those formula contain some iron and some pigment. It can color their stool. Their stool, you see that they pass a lot of stool and it's greenish. That one, there's nothing to worry about, is the formula. But based on breast milk, when they pass tiny, small greenish stool like that, we call it starvation stool. It's a sign of the fact that they're not getting enough breast milk. Or some of you, the way you breastfeed, the beginning part of the breast milk is what we call it fore milk. That beginning part of breast milk or fore milk is more of water. But the last part of the breast milk, we call it hind milk. That is the fat. So if you don't breastfeed your baby long enough to empty that breast, you will end up giving only more of the water, of the fore milk. At the end of the day, the baby is not getting the fatty part. And then that may also explain why they will have greenish too. So I always tell mothers, when you breastfeed, you must empty one breast, empty it completely. Then you switch to the next breast. Some of you also, you breastfeed only one breast. It's not right. You must breastfeed both breasts. That's why God gave you the two. You have to, because God knows that you need two. So you must breastfeed from both breasts. And usually mothers, you will know when you finish breastfeeding, you see the whole breast go flat, soft. You know that that is empty. Then you go to the one that is still full. But please, at least your baby should be sucking up to 10 minutes on each breast, and or at least when the breast is empty, you know it's empty. So it's very, very important so as to avoid the greenish stools. All right, let's go back to Instagram.
All right. Thank you, Doctor. We're back to Instagram. The luxury reporter is asking, how do you encourage children to eat fruits? My kids are not big.
Okay, good. That's a very lovely question. There are many ways to do that. One, model it. I always tell mother, when you are eating, you will see your children coming around you. They want to take what you are eating. They will think that there's something special about it. When you are eating apple, eating it, they will also want to eat it. That's one. Two, hide it inside the food. There are many ways to hide fruits inside food. So you're going to make cereal. You can make banana ice cream. Your children will not miss ice cream. When you puree it and you just put it for them, they will think it's ice cream and it's banana. You understand? So you can make it. So you can do smoothies and then you mix it with milk, and children they will like it. They will just think it's something lovely. You put the straw and everything. So there are many ways you can hide those fruits inside the normal food they eat. For example, you make your fried rice and all that. That is, you're adding veggies to the rice, and children will eat it. So they don't necessarily have to eat it like it is fruit eating time. Then you bring plenty of fruits. No. Then when they need snack, don't give them biscuit, don't give them pastry, give them fruits, give them carrot, let them be chewing on that one. Give them apple. You can cut it, dice it very well. You can make smoothie out of it. You can blend it into your food. There are many ways you can do all these things, and your children will not even know that they are eating those fruits. So those are, as parents, you have to be innovative. So, and some children really like the fruits as well. And experiment with different fruits. I know some children don't like some kind of fruits, of course. The one they like, let them eat much of those ones. Some parents will say, is it not too much? No, let them eat the much of what they like. At least have like two or three. I'm sure by the time you try 3 or 4 different, 5, 6, they may have like favorites of those fruits. Some of them, they can take it as juice. Like you can juice your pineapple, you can juice your apple, you can juice your what's it called, your oranges and all that, and they will still take those. There are many ways. It's just that parents, it can be stressful for us, but we have to do it. So just find one way that works for your family and do it.
All right. All right. came back saying, please, how do I know if my 9-month-old is constipating and the remedy for it?
Okay.
Takes fruits almost on a daily basis.
Okay, if you're 9 months old, if you're asking that question, it is very likely your 9 months old is not constipated. Because if your baby is constipated, you will know. Because constipation means that the baby find it hard to pass stools, and when they pass the stool is very hard, or it comes out as, what do we call it now? Like droplets, like round pellets, that's how it will come out very hard, very difficult. The child cries to pass the stool. They may not pass stool for days and all of that. So if your baby is not, so the fact that baby doesn't pass stool every day does not mean constipation. If when the baby passes the stool is a normal stool, that's fine. There are different children have different what we call bowel movements. So some people don't pass stool every day. Some pass stool every 3 days. Some people even do it once a week. But when they pass the stool, it will be normal, soft, like a sausage long stool. We call it Bristol short stool 4. So that is what we expect. So, but if the child is struggling to pass the stool is hard, it's coming out in pellets, or like corn, corn on a or corn, comb of a corn, like all those things around it, then that is hard stool, and that means the baby is constipated. And if your baby has constipation, we've already told what to do. It's more of giving water, fruit, veggies first. It is only if those has not worked, we can try stool softeners. And if that is still not working, then you have to see a pediatrician.
Okay. All right. Nikki B is asking, please, doctor, what causes umbilical hernia?
Okay, hernia. Okay, that's a very common question. It's a very common thing in Africa. I think I'm going to bring Dr. Oge back again. She's our pediatric surgeon, and she can discuss with us about hernia. But usually, hernia basically means there's a opening somewhere that should be closed, and some things that should not come out is coming out of it. So the one that happened in the umbilical area, we call it umbilical hernia. So there's that place where the baby's cord came out from, that is the umbilical. So normally after the baby, we've cut the cord, that hole should close. But sometimes in some baby it doesn't close completely, so it leaves a little gap. So sometimes some of the things in the intestine, some of the things in the abdomen, like the intestine, or some of them, they will be, or fats, they will be passing through that hole. But you will see that you can easily push them back. Then they will come. If the child coughs, they tend to get bigger. Then when you press it, they will go down. That is umbilical hernia. It's a very common thing in black children. But most of the time, because we know that with time they will close on their own, we just leave it. So most times surgeons won't operate you unless it's really big, and maybe at the age of 5 years it's still very big, and or it's become what we call obstructed. Like, sometimes when too much of them have passed through, they can't go back easily, then it starts giving pain. That is obstruction. It becomes even what we call strangulated. That is, there are complications. Then you have to go take the child to the surgeons. They will operate it and close the hole by themselves. But most of the time there's really no reason, because we just wait for it to close by itself. It's only if it is causing problem, or it's very big, or you don't like it, then the surgeons can operate it and close it.
All right. It's almost time, but there's still some questions here.
Yes, we still have a lot of questions on Facebook as well.
Latte Creations is asking, can my daily intake of tea affect my 3-month-old baby? I don't know what tea she's referring to. My daily intake of tea.
Tea.
Tea. Are you referring to tea bags or
beverage? Nigerian tea fashion. Okay, so there are some teas that you should not take, like the real tea, because when you talk about tea, you're talking about some leaves that have been made into bags and all that. So some of them are not good for you if you're breastfeeding, but most of the time they will write it on it, read it. So, but the usual tea that most of you buy, like all your lim tea and all those one in Nigerian market, most of those one are good, but green tea, special kind of tea, some of them would have written on it not suitable for breastfeeding mothers. Make sure you don't take those ones. But your usual beverage and your usual normal tea bags, normal, nothing else, it's fine. And if you take anything, but let me put a caveat there. If you take anything and you find out that it appears it affects your baby become a little more fussy. Like some people take ginger and it makes the baby more fussy and all that, then you stop it because your baby, anything you take can go into the breast milk and it can affect the baby. So your baby may be allergic to that. So you really need to be very, very careful. But really, you can take tea if you want. I don't think it should affect your baby as long as it's not something your baby is allergic or sensitive to.
All right. Gona Isiago is asking, what age do boys' genitals begin to grow or change?
Okay, so boys have their genitals present from birth. If I write from the womb, it is being formed, and I think the most important thing for us to know, the most important thing for all parents to know is that you must check that your boys have their testes present when they are born. They must check the balls. Usually, the pediatrician will normally examine the baby, but I've been finding that some of you deliver at home or you deliver in hospitals where they don't examine your baby. It is important that the babies are checked and that the testes are both in the scrotum, the balls, they are both present there. So that is number one. But the development begins to happen during puberty, usually from age 9, 10. That is when it will now begin to change. It will increase in size and the penis will increase in length, blah, blah, blah. So usually that happens during puberty. And for boys from 9, 10, that's when we expect them to start pubertal changes.
Okay, thank you. Tommy is asking, a child of 14 months used to snore while sleeping. I did an x-ray and I was told mild adenoid. What do I do next?
Okay, so I believe the person who had to do the X-ray must have told you what to do. But if you have not seen the doctor again, please go see them. But usually, if it is mild, we will do nothing about it. Usually, mild one means it's not causing any problem for your baby. The baby is just snoring, but the baby is otherwise well. The baby is not having frequent infections and all that. So we just leave it because usually the adenoids involutes. In other words, they go smaller by themselves. Usually by that around age 5, 6, it becomes smaller and it's no longer an issue. But there are reasons why the doctors may want to operate them. If it's a very big one, if it is causing the baby what we call obstructive apnea. In other words, baby is stopping to breathe. So the baby will snore and then go to a point where they actually stop breathing and then suddenly they'll start breathing again. We call it obstruction, and it's not a very good thing. So those are the signs. Or your child is having recurrent infections of the adenoids. If you have up to like 6 infections in 1 year, so you see the children always going in and out of hospital with throat infection, blah blah blah, fever all the time, being treated with antibiotics. So if we're having all those signs of obstruction, obstructive sleep apnea, infection, recurrent infection, or very bad, very big and adenoid that even the child is mouth breathing during the day, it's affecting the child's growth and development, then they may want to operate it earlier. So that's when you will see the ENT surgeon. But if it's just about the snoring alone, we will just watch and wait it out and see whether it will go smaller on its own. Can I go to Facebook?
Okay, that's fine for a while. Yeah.
Facebook people are going to be upset with me now. Okay, so let's quickly go back. Okay, I think I've answered this one. Okay, Mr. Friday on Nagise say my 4-year-old baby poo anytime she eats. Yes. Okay, yes. If you eat 5 times, she'll poo 5 times. There's nothing absolutely wrong with that. So it's a reflex. It's a reflex that whenever something enters into your stomach, it relaxes the part of the intestine where the stool are stored, and the person just feel like going to toilet. As adults you may actually feel it as well, but you just suppress it as an adult. But for children, they may just want to go. As long as the stools are not watery and there's absolutely nothing wrong, it's a normal physiological process. Just leave the child alone. You don't need to worry. As they get older, they begin to repress that reflex, but it's a normal reflex and it's nothing to worry about. Okay, Akinoye say, good evening. When can a mother be worried about his son not working? Usually, I would say 18 months. So after 18 months, if your child is not working, you need to see a pediatrician. If he's 13 months, so just let him be. So that's fine. How many weeks, month interval will a child grow another set of teeth after the first two teeth? I have no idea. Just let the child be. At least the child has grown two teeth. So this thing varies from children to children. So some children will bring out all their eight teeth at once. Some will bring out two, then take another 1 month or 1 year. But what we expect that by the age of 2 years, most of them would have brought out all their 20 primary teeth. So, but I see mothers worry a lot about teeth, whether the teeth is present, how many are present. All those things are still going to be lost by the way, so there's no need to panic, there's no need to worry about them, and the children don't need to the teeth per se for them to eat food. So just relax. So it varies from child to child, but the dentist say I should tell you that you should see them by the age of 1 year, whether the children have teeth or not. You should see them for the first dental appointment at age of 1 year, and then you should see your children every 6 months. I know it's not a culture in Nigeria, but ideally we should be seeing our dentists every 6 months. So I hope you. So whether you have concern or so, when you go for those regular dental checks, you can always have this conversation with the dentist. But there's really absolutely no reason to worry about teeth or how many or nothing to worry about. So Princess Loretta, my 6 month old is poor with watery. My 6 months 3 weeks baby poo is watery with mucus, and since yesterday he put 3 times. Two out of the three poo is watery. Actually, technically, your baby don't have diarrhea yet because we want babies to have three watery poo in a 24-hour period. So I don't think you should worry, but I think you should watch how you feeding your baby because your baby is 6 months old now. So I assume you have to introduce complementary food. Please make sure the water is boiled water, or at least a water that you bought enough. Even these days, some of this bottled water we don't know whether they are really pure or not. So you may want to see just boil them just to be on the safe side. Please hygiene, wash your hands often. The food, please don't give leftover food. Please make the food just before the children will eat them. Whatever is left over, please eat it by yourself or throw it away. I'm really serious. Yes. So these are the things that cause this infection, and children are still growing. Their immunity is not as high to handle some of these bacteria. So that is why it's important that we take extra, sterilize your feeding utensils. You don't if you don't have a sterilizer, or there are cold sterilizer, the Milton, just buy, drop one tablet in the, is it 5 liters of water, and put all those things there, or you just boil. Make sure you use the kind of utensils that can be boiled in hot water. So that is it. Just sterilize and use it. You just have to take precaution to avoid all these germs getting into the baby's food, and that will reduce all this diarrhea and everything. Thank you, Oyinyeshi, for joining us. Abisola say, good evening, doc. My 14-month-old doesn't like to eat. That's a universal complaint. I have tried everything on the complementary feeding course. Great. On your page, my baby doesn't even taste before rejecting. Great. And she's still below ideal weight because she was born preterm. Okay. Is there anything I can do to help on her weight? You didn't tell me her weight. You didn't tell me how preterm she is. So you really need to give me those information. I need to know her weight. I need to know how preterm she is, and we can work it out. But I just want to say, Abisola, the only thing you need to do now is to be patient with your baby. Okay, be patient. All right. So sometimes when you're introducing new thing, don't aim that that new thing the baby is going to take everything. No. And the first time you may just even let them play with the food, let them just touch the food, let them just smell it, let them just touch it and play with it. I know most mothers don't like that because it's a lot of work, but sometimes that is what the occupational therapists do for children that don't like food at all. They don't even want to touch it, they don't even want to taste it. You just let them play with the food. Your goal is not to let them eat it. You just want them to be comfortable with touching the food, playing with the food, pouring it on the floor. Sorry, get something to cover your carpet, and let them just play with it. and then you gradually introduce food. So the first thing will just be a spoon. When you are eating anything you are eating, put a little bit in the mouth. They don't really have to eat it as a meal, but you are getting them to learn to taste another. It's a lot of patience you have to do it. But if you really think you're struggling, please see a dietitian. They can walk you through the process. The dietitian can support you if it's really an issue. But I think most time for people that have done the course and all that, I also have a whole place where I list all the tips is to do it patiently and to persevere. Don't be in a hurry to give up. So sometimes we say when you are offering food, you must have offered a food like 13 times. So one whole week of offering that same food before you give up on it and say, oh, the baby doesn't like this one. And then also your preparation, your presentation, colorful, interesting. They are very, very important. And the child will also be interested with the color, will be interested in the texture, will be interested in all those things. So I know some babies are picky eaters. So like I said, if you are really, and some children actually have a disease condition, we call it avoidance restrictive disease. You know that some children actually have a disease where they don't really want to take food. I know, but it's not as if most children don't have that. So if you get into that point where you've tried everything, then that's where you need the professionals to now come in to support you. That's where you see your pediatric nutritionist, you see your pediatrician, then we can give you further assistance. So if you tell me the age of your baby and the weight, I will work out the rest. All right. Oluwaremilekun Christiana, 3 years, 10 months old, is having recurrent cough, catarrh. She's been given Zinat and Ventolin. So I'm suspecting they think your child has bronchial asthma. Yes, so the typical story of asthma is that it will come and go, it will come again. It is not going to be cured by Ventolin. Ventolin does not cure asthma. So if your baby is having recurrent cough and catarrh, you need to see a pediatrician who is going to make that diagnosis. I know some of my colleagues sometimes don't want to make that diagnosis because Nigerians, we don't like to hear some diagnosis, especially something that we know is going to be here for long. But if your child is being given Ventolin, that means somebody is thinking this child may be having asthma, and then they need to. But we don't like treating children with Ventolin syrup. I will never give you Ventolin syrup. We prefer the children breathe it in. So they breathe it in either as an inhaler or via nebulizer. Because see, when you give Ventolin as a syrup, it works on other organs that we don't want it to work on. So it can make the baby's heart to beat very fast and all that. We want it to go straight to the lungs when they inhale it so that it will open the lungs better. So I'm not so sure whether they've given you a diagnosis, and I don't want to give you a diagnosis online, but I'm wondering that if they are treating your child with Ventolin, are they thinking the child has asthma? And if the child is having recurrent cough, it's a very valid thing to think about. But please see a pediatrician who will do the proper evaluation. If the child meets the criteria, they will give a diagnosis, and then they will talk you through how to manage it. Because when it comes to things like asthma, the parents actually manage it. We allow you to do a lot of self-medication, not self-medication. We have to prescribe it first, but we allow you to do it at home. You must know when to nebulize the child. You must know when you need to go to the hospital. You must know what to avoid. What are the trigger factors to avoid? So there are so many things you need to know. So you really need to see a pediatrician and let them take it up from there. All right. What I'm looking at that helpful. Umpule say my baby of 4 years doesn't like eating. I think we've answered that question. We've answered the question. We don't like eating.
Yes, we have.
Yes, I think it's a universal question. Okay, somebody from YouTube, Hokoro, she's around. My baby of 6 months finished exclusive. That's lovely. Well done. But she doesn't like food in pure form. Yeah. She prefers solid. Yeah, then give us solid now, like gari and soup and other family food. Okay, now this is another thing I always like to answer all the time, because there is really no children food, there's really no family food. Because parents always think there are some food that are for children and there's some food that are for adults. Really, there is no food that you can eat that your children cannot eat. But when you are just introducing them to food, you're not going to give them a solid bowl of meat or a solid because they can't swallow it. So you need their own meat to be either shredded or pureed, something soft that they can easily swallow. But there's really nothing. So there's nothing wrong with your baby eating gari and soup. There's nothing wrong with your baby eating what you eat. But what I really want you to know is to make sure that you are adding other food. So in other words, if your baby is going to eat something like gari, you have to give it with a soup that has vegetables, whether it's a wedu or okra or other vegetable soup. And of course, there must be fish, other protein inside. So you must make sure you had everything. And it's actually saving you lots of money from buying things in the store when your baby can eat what you are eating from your kitchen. So if you have done our complimentary food course, you will see that the example they use in that course, they use real food. They didn't use any of those store things that people buy. You don't really need to buy any of those things. Your baby can eat whatever you cook in your kitchen, but you just have to make it softer. You have to make it easier for them to swallow. And as they get older, the food become thicker, become more solid. By the time they are 1 year old, we want them to be eating from the family pot. In other words, whatever you eat, they can eat exactly the same thing. They don't need to eat something different. So, but you see, that is why I say having that knowledge is very important, because parents always think complementary feeding is giving a particular kind of cereals and milk, and then you give it. No, that is where we mix it right from the beginning. From the beginning, you need to introduce everything. You must introduce all the different kind of food and not restrict them only to cereals and all that. And then because that will so Okoro, I think you're doing well, but please go and do our complimentary feeding course. So when people ask me questions, I know those who have done the course, I know those who have not done it. So if you have done the course, you will notice that these examples is not a problem at all. But the course will also tell you what quantity to give, because you're not going to give your baby a whole wrap or semo or hamala like yourself. Maybe doesn't maybe cannot tummy cannot take that quantity. So, but also what other things you need to add, and baby need to drink water. How often do you feed the baby? Those are important information that we all need to know. So I hope you go and do that course. Thank you for always joining from YouTube. I love the fact that somebody is watching on YouTube because most people on Facebook and Instagram. Okay. Odinaka is saying, what is the best treatment for rashes? Oh my God. So the powder I'm using isn't working and the rashes is much. Number one, there is no one single rash. There are different types of rashes caused by different things. Number two, there is no unified treatment, because I see one mother say my baby has rash. Somebody will just say go and use this, and I'm like, how did you know that's the treatment to you? Because there is no particular powder. I know there are some of them that are very popular that people like to make mention of their names. They don't treat every kind of rash. For example, some rashes don't even need treatment. Some kind of rash may be normal. For example, in a newborn baby, there are some whitish thing they have on their face. We call it milia. It's a normal kind of rash. You don't need to do anything. You just leave it alone. It's going to clear by itself. There are some rashes, like if you have eat rashes now, you can use the eat rash powder. There are some rashes that are due to allergy. Maybe it's the products, the soap, the cream, the sponge, whatever you are using on the baby's skin that is causing the rash. And what you need to do is to stop that, and the rashes will just go on its own. And now there are some rashes that are due to bacterial infection. If the rash is due to bacterial infection and you are using a cream that is an antifungal, it's not going to go, it's going to get worse. Or some rashes are due to fungal infection. So there are some rashes that are due to some skin condition like atopic dermatitis. So we need to see a rash. We need to know what type of a rash it is. We need to know what is causing the rash, and then we now know the treatment. So people just say my baby have rashes and you are using powder. It is wrong. Don't, just stop. I always say just stop everything you're doing. If you're on our Facebook group, you can post a picture. Some of the time we can see the rash. Sometimes we know, sometimes we don't know. Sometimes we need to ask you more questions, but because we can't do a lot of those kind of questions on Facebook, the best option is to take the baby to see a doctor who will examine the baby and will be able to tell you, oh, this rash is due to infection, or this rash is due to allergy, or this rash is due to a skin condition, and this is the treatment, or this rash doesn't even need no treatment. So these are the things that we need to know. And even where is the rash, or you didn't even tell us. So for example, the rashes in the nappy area, the causes may be different from the nappy around the neck area, around the folds where there's heat. So there are many information that we need to know when you ask about rashes. So it's a very difficult thing to even answer any question about rashes on live program because I can't even see your baby. I can't see the rashes. I can't even know what kind of rashes is. So I'll just say on the NACA that you really need to take your baby to the hospital to see one of my colleagues and let them examine the baby and then tell you. And please don't treat rashes. Sometimes our treatment make the rashes worse. So for example, some children have infection kind of rashes. Some of us go and use all this cream that has steroids in them. We are going to worsen the rashes. So that is why it's better to have us see a doctor and then they will take it up from there. Okay, into the what are the symptoms of umbilical hernia? I think we've answered that question of umbilical hernia. We've answered that
Yes, we
already.
did already.
Okay.
Yes.
Shakira is saying my baby of 8 month pool is very strong, so that is constipation, and we've answered question about constipation thoroughly. I also have some soft whitey stuff on her head like ringworm. Okay, if you observe whitey stuff on the head, yeah, you have to see a doctor for the treatment of the. If it, I'm not sure it's ringworm, it may be ringworm, you may be right. It may not be ringworm. There are many other things that can cause whitey stuff on the head, even dandruff, even the fact that the baby's head is not just being washed. So, but let's see. Usually, ringworm is round, it's very round and very, the hair on that area would have fallen off or things like that. But you may be right, you may be wrong, but usually, like I said, if I don't see a rash, I can't make a diagnosis. But you need to see one of my colleagues who is going to do the diagnosis, who is going to recommend treatment. Please don't use antibiotics or antifungal, antimicrobial treatment without a prescription. Please don't use them without a prescription. It's very, very important. Okay, I'm almost done. The last second to the last questions. She went to say, my baby is 1 month old and taking immunization. Are there drugs that should give her for the pain after taking the injection? And are there drugs that are a must for the first time on? Chiwendu, I'm very happy to tell you that there are no drugs that are a must for your baby or for you. You don't need to take no drugs. You can take multivitamins if you want to because you're breastfeeding, but if you actually eat well, eat your fruits and veggies, you don't necessarily have to take any drugs. And your baby don't need no drugs. Now, if your baby is 1 month, I guess you are talking about the 6 weeks immunization. At 6 weeks, your baby may have fever after the immunization, then you can give paracetamol, or that's what we recommend. If the injection site is swollen, you can put ice pack on top of it. That is what you need to give. The paracetamol work for fever, it will work for pain at the same time. But you can also apply ice pack so that the swelling will go down. What normally causes the swelling when a baby has injection into the muscle is blood. It is this, that is it, because that injection we give at 6 weeks. It's an intramuscular injection. It goes really deep into the muscle and there'll be some little bleeding. So, but what we need to make sure is that that bleeding stops. So you don't need to rub it. You don't need to apply any cream, no kerosene, nothing. Just put ice block on it. The ice block will kind of help the bleeding to stop. And then once the bleeding stop, it will form into something like it will become hard. It will gum together and then the body will now remove it gradually with time. But the most important thing is that don't let it get infected. And sometimes all this rubbing we do and everything, we introduce germs. And then when germs get into that blood, it will cause infection and then it become like a pus. It's become what we call cellulitis or an abscess like pus. Then we now need to treat baby with antibiotics. We now need to remove the pus. But if you don't do anything, just apply ice pack for 2-3 days, everything will go down and then your baby will be fine. But if you start, of course, it's normal for the baby not wanting to move the leg a little bit because it's painful. So just be gentle with the baby when you carry the baby. Be gentle with them and just be applying the ice pack. That's why you put it a little bit, you remove it. After a few minutes, you put it again, you remove it. You don't leave it permanently on. It's very cold, so it's just a little bit. But usually within 2-3 days, it will go down. But if it's not going down, you see hard, it's painful, it's beginning to look like there's pulse inside and all that, then you really need to take the baby to the hospital for that treatment. But if you actually do what I said, your baby will be fine. Okay, so the only thing you need to buy when you're going for your immunization, just buy paracetamol and Advd, and that's all. You don't need no other drugs. I hope that is helpful. Okay.
Yeah.
Uh, all right. I
Let's
think
come back to IG now.
yes. Okay. I have three more questions, but we can take the IG and I will quickly finish the rest of them.
Okay. My baby, this is from Udochi. My baby have a runny nose for the past 2 days now. I haven't used anything because it doesn't disturb her sleep.
Yeah.
Hope it's okay that I decided not to use anything and allow it to go on as it is.
You are doing well. It's okay. You don't need to do anything. How old is the baby?
She didn't say.
Okay. Please always tell me the age of your baby. Usually for babies that are below 6 months, I would just say keep breastfeeding exclusively because it will. If it's a baby above 6 months, let them drink a lot of water and fruits and veggies. Just it will help. So, but if it's a baby below 6 months, just breastfeed and keep them warm. That's fine.
All right. Going on, Ugonna is asking, is it okay to give children from 4 years and above daily multivitamins or vitamin C just to boost their immunity, even when they are feeding well?
Personally, we don't recommend that. I would rather your baby eat the fruits and veggies fresh and get the vitamin C from the direct source. But if you are not sure your children are taking enough of the vegetables and fruits and you just want to be on the safer side, then you can give them. There's nothing wrong with that. But it's better they eat it from the fruit itself. That's the best option because that's what the people that have done the vitamin C, what they've done is to extract it and put it into a tablet for you. But why don't just take it from your fruits, from your oranges and all those things directly is better, But if you are not sure, it's better to give the tablets and the syrups rather than not give at all. The baby need the vitamins anyway here.
Okay. He has a follow-up. She has a follow-up question. How true is this saying that if you eat one apple a day, it takes you away from the doctors?
Yeah, it's a good it is. I won't want you to take it like 100% verbatim correct, but it's just an adage, just like any of those wise sayings. Basically, if you take a lot of fruit, you are getting your vitamins, and that is the vitamins are very important. Just like what you asked earlier, they keep your immune system boosted, and that helps. That prevents you from having infection. Doesn't mean that it will protect you from everything. That's why we also give you immunization. That's why we also ask you to breastfeed. So the apple alone is not the only thing, but it's just a lovely way of saying that when you eat fruits, it helps your immune system, but it doesn't mean that you can never be sick because you are eating apple a day. No, don't take it that to that level.
All right, thank you. So I think here Dave is saying my baby never gets satisfied with breast milk. She can feed about 3 hours and still not get contented. At first, I thought I wasn't getting enough supply, but that's not the case. I do have enough supply.
So if you're having enough supply, it means your baby is getting enough. So you need to understand that sucking on the breast is not about feeding to the baby. So the fact that your baby is still sucking on the breast does not mean your baby is hungry. There are many reasons why babies suck. Babies suck, number one, to feel closer to you as well. It keeps them like, oh, my mom is here. It's part of their bonding with you. So it is not like the baby is sucking because they're hungry. No, sucking is also pleasurable. So some people just like sucking just for sucking sake, not because there's anything they want to, not because they want food. They just want to suck because it's sweet. It's sweetening them when they suck. So that is part of it. And also a way of them bonding with their mothers. So what I always tell people like you, if you are sure you are lactating well, your baby has finished sucking, your baby, you just stop the baby from feeding and just try and put the baby to sleep or put the baby on the bed or something away from you. So you don't have to keep sucking. So you yourself, you will know when your breast is empty now that the baby has finished sucking. So all the extra sucking on top is just, so it doesn't mean your baby is not getting enough. It doesn't mean your baby is not satisfied. The goal is not to satisfy your baby sucking. The goal is that your baby getting enough milk. And the most objective way for us as pediatricians to know whether your baby is getting enough milk is the weight of that baby. Is the weight. It's not how long the baby stay on the breast. It's not how many hours you breastfeed. What is your baby's weight? Is your baby weight age appropriate? and you've already answered the second question, which is that sometimes if you are not sure, we actually have you to express. Let's even know how much this baby is getting from your breast. So if you express and you're expressing a lot, which is what you're implying by what you said, and you give your baby that mix, and we know, like for example, if your baby is 5 kg, for example, maybe we expect you to take about 500 mils of breast milk in a day, and your baby is taking more than 600 mils from what you express, that means your baby is getting enough milk. Also, we will see it in the weight of the baby. So if your baby is gaining weight well, your milk is coming out well. So that sucking is not for food. That sucking is just your baby enjoying sucking, and you don't need to panic or worry about that. And you can find other ways of getting help. So sometimes it just needs the baby being away from you. Let other family members support you. When baby has finished eating, give the baby to other people to carry, because baby, as long as baby is with you, baby can smell the breast, baby can feel the breast, baby will want to suck on it. So that is it. So I'm happy you're able to figure it out by yourself, that your baby is actually getting enough milk. So you don't have to overfeed the baby. So that's fine. You don't need to worry about that. It's just baby just enjoy sucking. That's why some people use what they call it, all these dummies and all that. But we don't like using dummies because of the fact that we don't want your baby to be confused, nipple confusion and all that, and sucking in air, jams and all that. But it's one of the reasons why some mothers use those dummy in other places. But we don't really recommend it. Yeah. But you don't need to worry. If you're happy to breastfeed, fine. If you're not, let baby have other things to do and to give you a break.
I don't know if you saw a video that trended last week about baby. The mom was carrying the baby, and he had a slice of bread on his hand. He would eat, and then he'll go back to the mom's bread.
Exactly. Yeah.
Did you see that?
No, I didn't see the video. I didn't see the video. No,
It
no.
was funny. With bread and the milk directly from
Sucking is a very pleasurable thing. Actually, sucking is something pleasurable for children. They just like to suck. That doesn't. There's nothing wrong with that. So, but I just want the reason why I like your question is because I want mothers to think. Because people always ask that question that breast is not satisfying my baby. My baby is always sucking, sucking, sucking. And one of these I always ask them is to make them understand that all the sucking is not all about food. Some people use the breastfeeding to go to sleep. That is their own what do you call it, lullaby. What do you normally call what you
lullaby.
that is their own way of getting themselves to go into sleep. That's why some mother would like, once they get up from the baby will wake up, because baby wants the breast in the mouth. Sometimes it's also about security. The baby wants to be sure that you're not running away because you are the food supplier, the food bank. So they want to be sure that that food is always there. So we just need to understand this psychology of the baby. So I will only worry when you say your baby is not satisfied with breast. We are talking about the quantity of milk coming out of your breast. We are not talking about how long your baby suck on the breast. So it's very important. And if your baby is gaining weight well, your baby is getting enough milk. That is the most objective evidence of sucking enough. So all the other one is just enjoyment. Jara,
All right.
are you done?
Student Charities asked me, what can a mother do when her 4-year-old is hyperactive?
A boy, I guess. You never asked about hyperactive girls. Anyway, so hyperactive is a very subjective word. So what may be hyperactive for you may not be hyperactive for me. And sometimes when mothers say their babies are hyperactive, I look at the children and I just feel like this is a normal healthy child who is just enjoying themselves. So but I'm not disconcerning what you're saying. Some children have what we call ADHD, attention deficit hyperactivity disorder. Is a condition, but usually we don't make it before the age of 5 years. It's very rare. We are not going to treat it anyway before the age of 6. So if you think your baby's hyperactivity is too much, then you have to see a pediatrician. Then we can evaluate the baby for ADHD. But sometimes some of those children just have energy to burn, and some of you also give them a lot of sugar. And when you get a lot of sugar, they've got to burn it. So you need to make sure you're not giving them lots of sugar. Give them healthy fruits, apple, your fruits and all the rest. And let them also have time to burn the energy. So have something, your trampoline at the back door, or if you have a garden or they have a park. We don't have much of those in Nigeria, but in other places where they have those things. But you may have to look for a creative way of the children burning those energy. where they can run around, they can play. Then you now give them time. Okay, it's time, burn off energy, then time to calm down and do some other things. But if you think it's way above, usually the best people to know if a child is hyperactive are the teachers. The teachers will know because the child is so hyper, they can't sit still in the class, they may want to run out of the classroom, they can't finish their work and all that. So usually for us as pediatricians, if you are worried about your child hyperactivity, we want to ask from the school. We want to ask at the school, is the child also like that at school? Usually if the child is not like that at school, then it's just behavior. The child just wants to enjoy. Because usually hyperactive children, they can't help it. Children who have ADHD, they can't help it. Even in the classroom, they are very hyper. They want to run around and all that. So ask the school, the teachers of your child. Let them also give you their own perspective. And if they also have concern, please request a referral to developmental. I'm a developmental pediatrician. That's kind of patient I say. And you can request for a referral to see a developmental pediatrician for an assessment, and then the child can be supported. But like I said, we usually will not treat the children before the age of 5 or 6 anyway, so there's no reason to worry. Okay, but it's something we can deal with. Are you done?
All right, thank you, Doctor. No, I still have some boring well to say. What do you do to ease the pains of engorging breasts
Okay.
due to weaning? I tried expressing, but the milk didn't flow, and it's really painful.
Sorry, it's very painful. Take paracetamol, take painkillers. Take painkillers. You can also use warm compress like hot water, put clothes in hot water, dry it up and put it just to relieve. Don't worry, let the milk go out. You don't have to actively express it, but at least let some of it go away so it will reduce the pressure on you. Then take painkillers. You're going to just enjoy it for 1 or 2 days, and after that, as long as the baby is not sucking on it actively, the milk production begin to cut off from the brain, and then it will stop. But for the pains, take painkillers. You can use warm compress. Some people say cabbage help. So there are many. If you go to our website, we have a article on how to tips for winning. But I find that no matter what you do, you will still have 1 or 2 days of those painful period, then it will go away. But just enjoy it; it will come to pass. It's one of those things.
All right. All right. Sorry, boring. I hope you feel better very soon.
Sorry.
Mr. One day saying, thanks for the opportunity and for your selflessness. Please, can a 6 month old baby eat swallow?
Yes. Yeah, people need to go and do. People need to go and do the complementary feeding course. People are not doing that course. You need to go and do it. All those things you will not need to ask us. Of course, I'm not saying you should go and put apple or something. It has to be soft ones. Even if you are going to make it like your own, it may be softer in texture. So I usually find things like semo and mala. Those are lighter, softer swallow. And then you give it with veggies. It's very lovely. There's nothing you can make swallow out of your yam, like you don't need to call it swallow. You can make it like porridge, like those kind of things, like your yam, your rice. There's nothing you cannot do. The most important is that the child eats, but you add other food sources. So there must be fish or protein, there must be veggies, there must be milk, they must have at least nothing less than 4 out of the 6 classes of food that we normally talk about. So the protein must be there, the fat and oil must be there, the carbohydrates, which is your swallow, must be there, and of course your veggies must be there, dairy products must be there, and of course the baby must drink water as well. So those are the things you need to make sure. The most important is that you make it a complete food. So you don't only swallow only, no veggies, nothing. No, we don't want only one carbohydrates only kind of food, or only protein only kind of food. You must mix them well. So we have what we call my food plates, and it tells you how to divide the plates to make sure that all the food classes are represented. Okay.
This quote is saying, if you eat food cooked with chicken or meat without eating the meat, will you get the same proteins and nutrients?
You will get a little bit of it, but the best option is for you to actually, that meat itself, you can puree it. and then use it to cook food. So the meat is still part of it. That's what I'm saying. There are ways of giving this food to the children without them seeing it. If you boil your chicken very soft, and you don't even need to peel. If you don't have a blender, you just use your hand and make it into tiny pieces, something like strands and all that, something soft that the children can just swallow, and then you mix it with your vegetables and all that. It's fine. And children can eat it. Fish, all this powder, you can grind your fish, like all this our crayfish. You grind it into powder. You put a little powder of it into your pap when you're making pap. You've added fish to it, or you break your egg. That is protein. You've added protein to it. So the milk is also a good source of protein, and the dairy products. So you're adding everything together, and then you make, and it must be a thick pap. Oh. When you pour your pap, it should not pour, it should not enter into bottle. Please don't feed children with bottle. It should not pour like water, like this water. It should be able to hold on a spoon. When you put, if you do a porridge right texture, when you put it on a spoon and you turn it, it should not drop. So that means you're having the right test. So if it is dropping like water, it's too watery. So no matter what you mix as your porridge and all that, just make sure it's thick. Use plate, use spoon, use cup. Please don't feed children with bottle series from bottles. This is a wrong method. Yes. Okay, let me quickly finish the questions on Facebook, then we'll round up. How that's all for tonight. We've gone beyond our normal time. Okay, 1 more minute question answer. Okweluwa say my baby of 5 months has blood triple like a goosey. That is normal stool in a baby, but at times greenish. Maybe that's the time you are not feeding fully. Make sure you breastfeed completely, empty both the fore milk and the hind milk. But your baby is fine. Okweluwa. Olivia say, is it necessary to give 5 months old baby any TT medicine? No. Oh, I think you were late because I think I went on a whole rant about TT medicine for over like 5-10 minutes. Please don't give any TT medicine to any child. If your baby is having temperature and the test shows there's no infection, but the PCV is a bit low, there are many reasons why your baby can have fever. The fact that the test doesn't show any infection doesn't mean baby not have infection. If a baby have what we call viral infection are going to come out with normal full blood count results. So that does not mean the baby doesn't have any infection. Usually just give the paracetamol. If the PCB is low, I'm sure your doctors will tell you what to give in terms of either blood tonic, depending on how low it is. But it is not sitting. I'm happy that you've gone to the hospital, you have gone to do the right test. I hope you saw a doctor and not just doing tests by your side, which is another thing most of us do, which is wrong. Please don't just go and do blood tests without seeing your doctor, because your doctor needs to interpret the blood test for you in addition to what they have seen in your baby. They need to check the ears, check the throat, check everywhere the infection can be hiding. Sometimes we need to do a urine test. There are so many things we need to check. So please see the doctor first. Okay, my baby, Odinaka is asking, my baby is on exclusive breastfeeding. He sucks his finger a lot. And I've tried using hand gloves, but it sucks through. Someone recommend plaster. I see, I didn't know. We don't recommend plaster. So this is an habit some children pick up, especially, when they are putting their hands around their mouth, and they want, like I said, some children just like to suck. And some of them, when they don't have the breast milk to suck, they begin to suck on their fingers and all that. So it has become an habit for them. So most of them will stop it. It's something they also outgrow, usually by the age of 4 to 6. But like you said, you just try. If depending on your age of your baby, how old is your baby? You didn't tell us the age of your baby. You need to tell me the age of your baby. For example, if it's a child who is like 4 or 5 months, when they can hold things in their hands, I would just give them toys to hold in their hands, something to hold in their hands, so that they can do it when they are busy playing with their hands or doing things with their hands. It's very unlikely they're going to suck on that hand. So don't put plaster, don't put bitter leaf, don't put all those things on the hands of the baby. Just try and distract them away from it, or put other things in their hand. If it's a younger baby, then you need to learn to breastfeed your baby more frequently, so your baby doesn't have to be sucking on the hands. I think we have more tips depending on the age of the baby, which you have left out, which is very important. All right, thank you so much for everybody joining us. Thank you. Final question. Glory be to Almighty God. Oh, this is a spam. This is a spam question. Let me just delete it. Please don't be coming to our to come and be putting all those rubbish spams. Okay. Thank you. Thank you. I think we have done. Undo this. Say my baby is on EBF. She's always having hiccups. So it's
We
hiccup is
have
hiccup.
just flu more.
Okay, just a minute. ECOPS is one of those minor stuff. You don't need to do anything. It will stop on its own. If you make you feel better, because I know some others always like to do something, just breastfeed. But if you just leave the baby alone, the ECOPS will stop. It's a minor thing and doesn't mean there's anything wrong with your baby. So you don't need to give anything. You don't need to apply white clothes to the head. She doesn't do anything. But that's just it. Okay, so thank you so much, Facebook. We are done. Okay, let's finish with
All right, just I think two more questions
okay, you are breaking
on
now.
Instagram. Please, what can actually stop? Can you hear that?
Okay, I can hear you now. Go on.
Is it better?
Better, yes.
Okay. Hurry up. What can I do to safely stop my baby from biting my nipple? I don't want to beat her.
Don't beat the baby. Why will you even beat the baby? Don't let me come and fight you too. Please don't beat children. When we beat babies, before I go into the question you're asking, it is not appropriate because infants don't understand. They don't have that understanding of what they are doing versus what they consider. Their brain has not yet matured to that level. So beating a child who is less than 1 year old, you are just punishing a child for being a child. You are just punishing them for what they even have no idea what they are doing. Please, what you need to do is to remove them from that situation. So if a baby beats your nipple, they can't help it because sometimes it's their teeth. Sometimes their own teeth is also disturbing them. And like when, especially when they're about to bring out new shoots or something, so they want to bite on something. So you give them a teeter, something soft, like cool teething rings. They can bite on that. That's fine. So your baby begin to want to bite you. That means you just what I normally tell them, just stop the breastfeeding at that point. You can put in one of your finger into the mouth and depress the mouth, and the baby will cut off from the breast milk and just let the baby be for a few seconds. Sometimes maybe that baby, depending on the age of the baby, there are different scenarios. But usually these children are the age where they are bringing out their teeth. Usually that's when you get a lot of the biting. So sometimes they just need something else to bite on. So you can give them a cool teething ring to bite on and all that. So if you stop the breastfeeding after a while, baby still wants to breastfeed, then you can start. You will notice that baby is very unlikely to bite you again. It's a very common thing, but usually with time, or usually they do it during that phase when their teeth are about to come out and they can bite anything. So just give them something else different to bite on rather than your nipple. So just endure for us. And usually, after a few days, once the teeth itself is out, then they will stop. But don't beat the child. Then don't make the child. Sometimes when we do some of those things, we actually reinforce the habits that you are trying to stop because you make the child feel like when I do this thing, I get a response from you. And then the child actually may want more of those response or something. It's a kind of a negative kind of reinforcement. So you don't want to do that. And anyway, you also not we don't want you to be punishing a child for what they have no clue they are doing. So it's just something physiological for them. Some children have some other habit that they just tend to bite people a lot. So that's a different thing entirely. But a baby who is breastfeeding and biting on your nipple is a different thing entirely. So you just need to stop the breastfeeding for a few minutes, give the baby something else to bite on, and then you can resume the breastfeeding later on when the baby is calmer. And usually they don't keep biting you on continuously. That's very unusual. So most like when you start again, the baby is very unlikely to keep biting you. Sorry, I know that can be painful. That's one of the challenges of breastfeeding when your baby now start having their teeth out. Yeah. Are we done? Somebody say you didn't read their question, no, that the baby was 2 year old as H. pylori and your 4 year old as H. pylori as well. So you really need to go and see the doctor, the pediatrician. H. pylori is an infection, and it's an infection that is associated with peptic ulcer
There's a
disease.
question here. She says, my 2-year-old. Yeah.
Yes, I already read the question. Yes, that was the question I'm answering now.
My 2.
Okay, I think you are breaking, Angela. Okay, anyway, I think I've started answering the question. You really need to see the pediatricians. Number one, I just want to be sure that the right people giving you the diagnosis of this H. pylori is correct and it's not something they are just dashing your children. But I'll really say see a pediatrician and then they can take it up from there. And it's I don't think it's something that is passed from one person to another person in a family setting. No, but it can be treated. That's what I'm saying. It can be treated, but the treatment is a little bit longer because sometimes we want to do what we call eradication treatment. And so that is why you really need to see a pediatrician, preferably a pediatrician who is into a pediatric gastroenterologist. That's their own field, and they can support you with that. And yeah, you didn't really tell me the setting why your children were even being tested for H. pylori in the first place. Did they have symptoms of Peptic ulcer disease or what? Why did they go for H. pylori? Because it's not something people routinely test for. So there are some other information. I know you won't be able to share all that with us on a live program, but definitely you need to see your pediatrician. It's an infection, it's a bacterial infection because they say what is the cause, that is the cause, and all that. Okay, somebody is saying, can you recommend any neuropediatrician in Lagos? Yes, ATP, we have pediatric neurodevelopmental pediatrician in ATP. So you send us a DM, we will tell you how to contact us. We offer ATP clinics and we can see your children for you. And if you need face to face, some of my colleagues can see you face to face as well if it's needed. Yeah, ATP doesn't have an hospital, but we do video consultation, and some of our colleagues can see you physically if you want to, because I can see somebody who is asking about that. Yes, you can send us a message. We have our ATP clinics information, but I'm not so sure whether I can't give you right from my brain now. But if you send us a DM, we will respond to that, and then we'll tell you how to contact us. Or you can, if you look through our page, you will come across it as well. Okay. All right, I think we're done. We're done. Thank you so much, um, Angela, for joining me today. Thank you so much. It's nice having you. Thank you. Angela, are you still with me? Angela? Okay, it's like Angela is
Thank
lost.
you, Doctor. And to everyone who joined us too. Yes, I'm here, but there's a delay from my end.
Yes, I'm getting that delay.
I'm still here, delay
Okay. All right. So if you still have questions, thank you, Angela. If you still have any question, we have already gone beyond. Normally we do 1 hour live. We have almost done 2 hours today. But if you still have question, please feel free to post your question on Ask the Pediatrician Facebook group. Our Facebook group operates Mondays to Saturdays, 24 hours daily. So you can post your question, we will answer you there. If you're on Instagram or YouTube, we don't do question and answers on Instagram because it doesn't have the mechanism for us to be able to do it safely. And we are very, very, very careful with the way we answer questions. So please feel free to go to our Facebook group, join our Facebook group, ask the pediatricians for health questions for children. For adult health issues, you can join our ATP family, ask the family physicians, and you can post your own health questions there. So we come across the way again every Monday from 6 p.m. where we do our live question and answer. So hopefully we'll see you again next week Monday. And thank you so much for all of you for joining us. Bye. Bye. Thank you, Angela, thank you to Facebook. Bye.
Bye.
Bye
Bye,
bye.
everyone. Thank you.
Bye.